Watch out for these early signs of Alzheimer's and dementia. Did you know that every 3 seconds someone in the world is diagnosed with Alzheimer's or dementia? With the aging global population, these cognitive disorders are becoming an increasing concern for millions of people and their families. Alzheimer's, which affects memory and the ability to think clearly, and dementia, which impacts overall brain function, have profound effects on quality of life. Identifying the early signs of these conditions can be challenging but is crucial for ensuring early diagnosis and better quality of life. In this video, we'll explore the early signs of Alzheimer's and dementia that can appear after age 50, how to recognize them, and what steps you can take to prevent the progression of the disease. Remember, while information is a key step, seeking specialized medical help is essential for effective treatment. Stay with us and discover how you can make a difference in your health and the health of your loved ones. Number 1. Recent memory loss. Recent memory loss is one of the earliest and most noticeable signs of Alzheimer's, characterized by difficulty recalling recently acquired information, such as recent conversations, appointments, or where items were placed. Unlike occasional memory lapses that everyone experiences, this difficulty is persistent and interferes with daily activities. Patients may repeatedly ask the same questions or forget events that just happened, causing frustration and confusion for both them and their families. This symptom occurs because Alzheimer's initially affects the hippocampus, the brain region responsible for forming new memories. To mitigate these effects, it's essential to stimulate the brain with activities that challenge memory and keep neural connections active, such as reading, solving puzzles, and social interaction. Additionally, maintaining an organized routine with visual reminders and using planners can help manage these difficulties. Number 2. Difficulty planning or solving problems. Difficulty in planning or solving problems is an early sign of Alzheimer's, often manifesting in tasks that were previously easy, such as following a recipe, organizing an event, or managing personal finances. This limitation arises from the deterioration in brain areas responsible for logical reasoning and decision-making. Patients may take longer to complete simple tasks, show confusion when dealing with numbers, or feel overwhelmed when trying to solve unexpected problems. The progressive loss of these skills affects not only independence but also the individual's self-confidence, leading them to avoid complex tasks for fear of making mistakes. To slow down this decline, it's advisable to keep the brain active with activities that require planning and problem-solving, such as strategy games or learning new skills. Additionally, setting clear routines and using tools like checklists can help organize daily life, reducing anxiety associated with these difficulties. Number 3. Difficulty completing familiar tasks. Difficulty in completing familiar tasks is another common symptom in the early stages of Alzheimer's, where routine activities previously performed automatically start to become challenging. Tasks like preparing a simple meal, shopping, or even personal hygiene may be done incompletely or with errors. This difficulty arises from the impact of the disease on brain areas involved in procedural memory and concentration. The person might start a task and then forget what they were doing or how to complete it, leading to increasing frustration. Additionally, there may be a decreased ability to adapt to new situations, making the individual reliant on rigid routines. To address these challenges, it's useful to simplify tasks by breaking them into smaller steps and using visual or verbal reminders. Encouraging consistent practice of these activities and providing adequate support can help preserve the patient's autonomy and quality of life for a longer time. Number 4. Confusion with time and place. Confusion with time and place is a characteristic sign of Alzheimer's, reflecting the impairment of spatial and temporal orientation caused by the disease. Affected individuals may lose track of time, forgetting dates, seasons, or even the time of day. Everyday situations, such as forgetting the way home or not recognizing familiar environments, become increasingly frequent and distressing. This disorientation results from the degeneration in brain areas responsible for spatial perception and contextual memory. Consequently, the patient may have difficulty following routines, attending appointments, or even locating themselves in familiar settings. The feeling of being lost can lead to social isolation and increased anxiety. To mitigate these effects, it's crucial to create a well-defined routine with consistent schedules and visual references like calendars and clocks in strategic locations. Additionally, keeping a familiar environment organized and offering supervision during outings can help reduce confusion and enhance the patient's safety. Number 5. Vision and spatial understanding problems. Problems with vision and spatial understanding often emerge in the early stages of Alzheimer's, reflecting the deterioration of brain areas that process visual and spatial perception. Patients may start to have trouble judging distances, affecting motor coordination, and perceiving contrasts or colors, which can impact activities like driving, reading, or even walking without bumping into objects. This impairment can lead to an increased risk of accidents, such as falls, and growing insecurity while performing daily tasks. Distorted spatial perception can also make navigating familiar environments challenging, causing the patient to feel disoriented or lost. To address these challenges, it's important to adapt the environment by ensuring good lighting, removing obstacles, and using contrasting colors to mark steps or entrances. Additionally, encouraging regular checkups with an ophthalmologist can help identify and treat visual problems that might further exacerbate these difficulties. Number 6. Problems with speech and writing. Problems with speech and writing are significant symptoms of Alzheimer's, indicating the impact of the disease on brain areas responsible for language. Patients may start having trouble finding the right words, leading to long pauses during conversations or the use of less precise words. This phenomenon, known as anomia, makes communication less fluid and can cause frustration for both the patient and those around them. Additionally, the ability to form complex and coherent sentences may deteriorate, leading to repetitive or disorganized speech. In writing, these problems manifest as grammatical errors, difficulties in organizing ideas, and less legible handwriting. Over time, the patient may avoid verbal or written interactions for fear of making mistakes, contributing to social isolation. To help preserve language skills, it's advisable to encourage daily conversations, reading, and the use of strategies like repetition and gestures to facilitate communication. Number 7. Losing items and difficulty retracing steps. Frequent loss of items and difficulty retracing steps are common manifestations in the early stages of Alzheimer's, reflecting impairment in recent memory and executive functions. Patients may forget where they placed everyday items, such as keys, glasses, or wallets, and, when trying to recall, struggle to mentally retrace their steps to locate these items. This type of forgetfulness goes beyond the usual and is persistent, creating a cycle of frustration and anxiety for both the patient and caregivers. Losing items often occurs because the individual places objects in inappropriate or unusual locations, which exacerbates confusion. This difficulty in retracing steps can also extend to more complex activities, such as remembering the sequence of a task started or following a logical sequence of actions. To minimize these impacts, it's helpful to establish fixed places for important items and create visual reminders to aid organization. Additionally, maintaining a simplified environment and avoiding sensory overload can help reduce the frequency of these episodes. Number 8. Impaired judgment. Impaired judgment is a striking symptom of Alzheimer's, reflecting the deterioration of cognitive abilities responsible for making sound decisions and evaluating everyday situations. Patients may display impulsive behavior or make choices that previously seemed clearly inappropriate, such as spending large amounts of money irresponsibly or neglecting personal hygiene. This decline in judgment affects the ability to distinguish between what is safe and what is risky, potentially putting the patient in dangerous situations or vulnerable to exploitation. Moreover, impaired judgment can lead to health-related decisions, such as ignoring symptoms of illness or adhering to ineffective treatments. This symptom is often accompanied by a reduced ability to anticipate the consequences of actions, increasing dependence on family members and caregivers. To protect the patient, it is essential to implement financial and health supervision measures, as well as encourage participation in supervised activities that promote safety and well-being, reducing the risk of harmful decisions. Number 9. Social withdrawal. Social withdrawal is a significant and often underestimated sign of Alzheimer's, emerging as a response to increasing difficulties in maintaining social interactions due to cognitive decline. Patients may begin to avoid family gatherings, meetings with friends, or activities they once enjoyed, due to feeling insecure or embarrassed about their memory, language, or judgment difficulties. This isolation may be driven by the fear of making mistakes in public, not recognizing familiar people, or getting lost in conversations. Withdrawal not only worsens loneliness and depression, which are common in Alzheimer's patients, but also accelerates cognitive decline, as social interaction is a vital stimulus for maintaining brain functions. It is therefore crucial to encourage participation in socially adapted activities, such as support groups or family gatherings in familiar and calm environments. Keeping an active social circle, even if limited, can provide emotional support and help preserve self-esteem, as well as slow disease progression by stimulating the brain through meaningful interactions. Number 10. Mood and personality changes. Mood and personality changes are notable manifestations of Alzheimer's, reflecting the interference of the disease in brain areas responsible for emotional and behavioral control. Patients may experience sudden and intense mood swings, such as irritability, apathy, or euphoria, which do not match the current situations or contexts. These changes may also include unusual behaviors, such as distrust, aggression, or a general lack of interest in previously enjoyable activities. Such emotional fluctuations occur due to the degeneration of brain regions involved in emotional regulation, such as the prefrontal cortex and the limbic system. Changes in personality can result in difficulties maintaining stable relationships and create a tense family environment. Besides being challenging for the patient and their family, these changes can make it harder for the patient to adapt to routine changes. To manage these issues, it is essential to provide consistent emotional support, establish a stable routine, and use behavioral management strategies, such as redirection techniques and validating the patient's emotions, to help maintain a more predictable and less stressful environment. Throughout this video, we explored how to identify the early signs of these cognitive disorders and discuss strategies that can help slow their progression. Remember, recognizing subtle changes in memory, planning, and behavior can be key to successful intervention. Caring for mental health is as crucial as physical health, and small lifestyle changes, along with regular medical monitoring, can make a big difference. If you've noticed these signs in yourself or someone close, don't wait to seek professional help. Early diagnosis and proper support are vital for improving quality of life. Take care, stay alert, and don't hesitate to seek expert support. Your health and well-being are top priorities. Thanks for watching until the end. Don't forget to like, subscribe to the channel and share with your friends.